Welcome patients, families, researchers, health professionals, and decision makers to the Maternal Hyperoxygenation in Congenital Heart Disease, or MATCH study, Child Bright Project Update.
In 2017, we began the MATCH study to ask whether supplemental oxygen during pregnancy will improve brain development in fetuses with complex congenital heart disease. This is because brain development is impaired during prenatal life, which may be due to the abnormal flow patterns and reduced oxygenation to the developing brain.
Our study involved two objectives. First, to quantify the impact of a short 45-minute duration of maternal supplemental oxygen on brain oxygenation in fetuses with different forms of complex congenital heart disease in the third trimester. And second, to investigate the effects of long-term maternal supplemental oxygen on neurodevelopment in fetuses with single ventricles throughout the second half of pregnancy.
Our team has made great progress, where so far we have recruited 66 of 150 mothers for our short-term supplemental oxygenation study. In this study, we recruited 28 fetal patients affected by transposition of the great arteries. Our results revealed short-term maternal supplemental oxygenation causes a redistribution of flow towards to the fetal pulmonary circulation. But there was no improvement in fetal brain oxygenation, suggesting a limited role of this therapy to improve fetal brain growth in this patient population. However, our results suggest short-term maternal supplemental oxygenation may play a potential diagnostic role to identify whether there is communication between the two atria, and if there isn't, may inform clinicians for perinatal interventional management and prevent pulmonary vascular disease.
For our long-term supplemental oxygenation study, we recruited 24 of 30 mothers to assess the safety and feasibility of our intervention. So far, we found no harmful effects to the baby or mother attributed to the oxygen. However, we did find that our babies were smaller at birth by approximately 234 grams, but without clinical concern. On the bright side, our newborns had less brain injury before the first cardiac operation compared to those who did not receive supplemental oxygen by 23%, suggesting that there might be a potential neuroprotective effect from our intervention. Nonetheless, we are working closely with our Data and Safety Monitoring Board for detailed monitoring of the safety of this trial. As part of the Child Bright Network, we actively keep in touch with our mothers and families. Through weekly phone calls to our mothers during their intervention, discussions during hospital visits, we shared our experiences with each other to address strengths and weaknesses of our study. For example, our mothers and families expressed their gratitude for the active support and flexibility from our healthcare team. On the other hand, participant engagement has led us to improving the intervention, such as by humidifying the supplemental oxygen to resolve dry noses. However, we must tip our hats to the champions of our study, to our mothers and families who have shown great resiliency, courage, and strength throughout this process.
Thank you very much for listening, and we would like to invite you to attend our poster session for more details and discussion on this project presented by Dr. Li-Kun Sun and Kevin Lee, our PhD student.
Hi, I'm Ann Sinnis, and I'm thrilled to talk to you today about what we have accomplished in our Child Bright Project 1.2 Parent Epic. Child Bright 2, my colleague Dr. Tui Mai Lu will be taking over leadership. I want to highlight the important role that parents such as Rebecca Pierce and Fabiana Bacchini have played, as well as the Canadian Neonatal Follow-Up Network and other partners. I took the protocol, which we wrote at the beginning of this study, and looked at the milestones and deliverables we said we would accomplish. I'm thrilled to say that we have either met or are close to meeting almost all of our goals, both in terms of completing studies, writing publications, and we have actually exceeded expectations in our knowledge translation and dissemination. The only challenge we've had was looking at the outcomes of preterm children before and after the Parent Epic intervention, because these interventions were delayed by COVID. A quick overview of the 3 studies that are already published, 1 accepted, 2 submitted, and 2 are in final draft. We have published 4 annual reports with this year's almost done. So we're still keeping busy with research in progress, and I'll tell you how we're transitioning to Child Bright 2. We held a workshop in September 2021 where we reviewed our parent epic results, and using a Delphi process, we created consensus statements, some of which have already been implemented. And we also identified gaps in knowledge, for which we created working groups, and they presented results at a workshop we held this September. And this will create the foundation for publishing recommendations. With help from the Canadian Premature Baby Foundation, we have produced a medley of social media and other tools to disseminate what we have learned. In Child Bright 2, we will use implementation science to implement the recommendations from Parent Epic. So, in summary, we feel that Parent Epic has met or exceeded expectations for all goals except measuring the effect of Parent Epic interventions, which was delayed by COVID. We have had a lot of fun and have developed a great relationship with our parent partner, Canadian Premature Babies Foundation, and are exceeding our plans for knowledge dissemination and implementation. Thank you to everyone who has helped us make our study a success, and we are grateful for funding received by CIHR to fund Child Bright and matching partners. Thank you, and I look forward to your questions.
Hi, everyone. Thank you for the opportunity to present today at the Child Bright virtual conference. I'm Don Mavitt, and on behalf of myself and Dr. Darcy Failings, who is with me as well, we want to give a brief update to the group on the Metformin for motor and cognitive improvement in children with cerebral palsy study. This is the Child Bright Network Project 1.3 study. And we're quite excited about where we've gone with this. Just a bit of background for you, first of all, so that you remember, we're using metformin, which is a drug that's typically used to treat diabetes, but colleagues at University of Toronto, primarily Cindy Morsehead and Frida Miller, have shown that the drug metformin actually acts on the brain's own stem cells to foster brain recovery and brain support. Subsequently, we've conducted a study in other populations showing that metformin actually helps white matter grow and helps with cognitive abilities like thinking and learning. But this study that we're talking about now is the first study to use metformin for children who are diagnosed with cerebral palsy, who, as we know, have white matter injury and have motor and cognitive issues. Metformin does have some typically common side effects: abdominal pain, diarrhea, headaches. You see the other ones there. And so we want to be able to look at, is it feasible to conduct such a pharmacologically based brain repair and motor repair study in children with cerebral palsy. And with that, I'll pass it on to Dr. Failings, who can tell you about the actual study.
Thanks so much, Don. So these are the questions we are aiming to answer in our study. And the first one, feasibility. We started the study as a double-blind randomized trial, and we found that it wasn't feasible. We had a lot of trouble recruiting children into the study. And of course, the pandemic didn't help. So we've done a change to the study design, and we're going to tell you a little bit about that in a second. The other research questions we really want to answer is, does metformin enhance motor control in children with cerebral palsy? And also, does it have a positive impact on cognitive outcomes such as attention and speed processing and memory? So I mentioned we have a new study design. So the double-blind randomized control trial, the initial one, randomized children to either receive the metformin or not. And we heard from families that they were more interested in a study where they would have a good chance of receiving the metformin. So we've moved to this ABA design. It is A, a period where we don't get metformin over 16 weeks, and then B, a period where we get metformin over 16 weeks, and then another 16-week follow-up period. And this is where we collect our outcomes. The X is our gross motor function. C is our cognitive function testing, and M are the MRI or brain images. Red corresponds to no metformin, and then the green is where we have the metformin. So we're really excited to be moving to this ABA design. We think it'll be easier to recruit children and families into the study. And we are hoping to get to our first recruitment starting in the new year. We have REB approval for this new study design, and we are in the process of submitting to Health Canada. So thank you very much. We really look forward to any questions that you have for us.
Hi, everyone. My name is Adam Curtin. I'm a pediatric neurologist in Calgary, and I'm pleased to provide a summary of the SPORT trial, Project 1.4, on behalf of my fabulous team of collaborators here in Calgary, Alberta, and Toronto. The SPORT trial is a large, randomized, controlled, multi-center trial, which aims to answer the question of whether non-invasive brain stimulation is able to enhance motor learning and motor function in children who have had a perinatal stroke and have hemiparetic cerebral palsy or weakness on the opposite side of the body because of that stroke. This picture here is a snapshot of some of the kids participating in what was a camp-based model of intensive, personalized, peer-supported rehabilitation here at the Alberta Children's Hospital, also in Edmonton and Toronto, as I mentioned. The kids would set their own goals and enter this camp, attending every day for 2 weeks. And during the camp, they would be randomized to receive a form of non-invasive brain stimulation called transcranial direct current stimulation. The machinery is shown up here in the top right corner, which has been shown to enhance motor learning in adults and healthy children. But this trial was designed to determine whether it could actually work in kids with motor difficulties like cerebral palsy. We enrolled 86 children over 3 active years of enrollment plus 2 years of pandemic, and finished in the summer of August 2022. The final clinical outcomes will be due in a few months when we get to our 6-month final outcomes, allowing us to publish the final results of the trial. But overall, things have gone very well. The engagement, participation of families has been tremendous. We've had spontaneous feedback like this great text we got from this young boy in the camp after a few days where he felt like his hand was doing something it couldn't do before, and was very excited about it. We consider that a great outcome. And here's some snapshots from our final day wrap-up water gun fight with some of the kids in the Calgary camp, and the great level of enthusiasm and participation that our team so enjoyed having with these kids. So stay tuned for the final results. Thanks to our terrific team here in Calgary, as well as those in Toronto and Edmonton. Thanks to the funding, especially from ChildBright. And I look forward to sharing the final results with you when they become available soon. Enjoy the symposium. Thank you.
Hi there, my name is Dr. Serene Kirpin. I am a principal investigator along with Drs. Jennifer Walker and Astrid Gutman on the prenatal opioid exposure in First Nations community project funded by ChildBright. So in many ways, our work is supporting First Nation-centered research. And one of the things that I did want to share before we get started is that all aspects of our work have been community engaged from the beginning of design all the way now through knowledge translation and mobilization. And this is just one of the ways that we are working to uphold the First Nations principles of OCAP. So about our study, we are collaborating and partnering, and we have been, for the last several years with 13 First Nations in Ontario to help communities access and utilize health records data that on the rates of prenatal opioid exposure and neonatal abstinence syndrome, along with important health indicators for moms and babies. And then we have also been leading a qualitative arm to our project where we are looking at the impacts of prenatal opioid exposure along with the strengths that exist in communities that are already addressing it, because communities have been doing a lot to address prenatal opioid exposure already, and then the strategies that they would like to move forward with in the future. And some of those we will be looking at in phase 2. So we have, we're just at the final stages of returning our phase 1 findings to communities. One of the primary mediums that we have done this through is through 13 reports that have been tailored with community-specific data, both quantitative and qualitative, and then returning those and then doing many presentations in communities to answer questions and answers and deliver sort of main findings. We've also developed a very large and robust aggregate report that provides a summary of the findings from all 13 communities together. And you know, we only have 3 minutes, so it was sort of tough to determine how do you summarize just what is a copious amount of data, but also many years of work. But without putting up some data, what we found is that prenatal opioid exposure is definitely a challenge for First Nation communities. It's quite clear. But what we've also seen is a high level of resiliency and strength in communities and families and individuals who are working to overcome it. And what we also know is that communities have expressed that they are incredibly eager to move forward with knowledge mobilization from the findings. So bringing together that quantitative, the rates data, with the qualitative on what's working and what do we need to also do to really support families and specifically children impacted by prenatal opioid exposure. So we're really excited about moving into phase 2. And I'm happy to answer any questions pertaining to our study. Thank you very much.